We still have seats up at the table. We also do have on the 5th floor some additional space as well. So we have most of our bureau staff is up there, so we have more chairs available here. So please find a seat. If you're a committee member, come on up. So we will go ahead and call order. It is officially 9:30. Shelley, if we can do roll call, please.
All right. Brian Smith.
Present.
Chris Salvino. Dale Woolridge.
Present.
Daniel Spade.
I'm here.
Deborah Grande. Present. Edgar Bissonette.
We should have Edgar online. Deb and Edgar, if you can just put something in the chat or just come off mute so we can capture your attendance, please.
Bronco Castromarin.
Present.
Gail Bradley.
Present.
Darth Gamer.
Present.
Glenn Kasperson. Heather Miller.
Present.
Howard Reed. Eve Godstanker.
Present.
James Hayden.
Present.
Jesse Torres. Nick Ells.
Present.
Ray Ochoa.
Present.
Rod Reed.
Here.
Roy Royals Friends.
Present.
Sarah Parati.
Present.
Shari Brand.
Present.
Stevie Merrill. Todd Aramil.
Present.
Vince Martinez. Vivian Gellert.
I see you in the chat. We've captured your attendance as well. Thank you.
We do have one.
Thank you very much. I just remind you, the attendance report is in the packet. If you missed 2 or more consecutive meetings, the Bureau will reach out to you to ensure that you still would like to participate in the committee. Reappointed members, congratulations, Dr. Woolridge, who is reappointed. We currently have 6 vacancies. We have 3 public members, a hospital administrator for a county population greater than 500,000, a physician specializing in emergency medicine from local EMS coordinating system Western region, and 3 largest employers of EMCTs for Tucson Fire. We do recognize that many of you have submitted your applications, and those are pending at the Governor's Office Board of Commission. So just a reminder, if you are coming up for a term expiration, please fill those out early. Those do take a little bit of time to get processed. Shelley can do some follow-up with the commission, but unfortunately we are a little bit at the mercy to get those appointed. Next up for the naloxone leave behind. So I just wanted to kind of briefly cover the naloxone leave behind program. A huge thank you to all the EMS agencies that have participated in this. We have currently trained about 2,500 EMTs and paramedics across the state of Arizona, have done the training for naloxone leave behind. We have also disseminated, I believe, close to 1,200 kits to EMS agencies, and about 180, I think at last count, have actually been given out in the community. And this means that the EMS provider who has given that kit out in the community has scanned the tag and identified the zip code and their agency name for where that has been given out. So really big thank you to everyone who has participated in that program. If you're interested, there is a link in the agenda that will take you to our webpage. There's a link to sign up for the training for your agency and also how to get the naloxone kits from us. So a big thank you to everyone who is participating in that. Next, if we can open the Governor's Proclamation. All right. So we wanted to recognize that this month is Trauma Awareness Month, EMS Week, as well as EMS for Children Day. And so we have a very nice proclamation from the Governor's Office acknowledging all 3 of those special events this month. If you can go up just a little bit further, there's some really nice statistics that are in there. I think this is impressive when you look at what was actually put in the proclamation. So the volume of calls responded to for stroke, for STEMIs and cardiac arrests in the state, traumatic injury, substance use disorder, and heat-related emergencies. So really a very large volume of calls that EMS providers are responding to what we really term time-sensitive illness and injuries, things where what you guys do in the field make a difference in that patient's outcome. So a big thank you to everyone for all their work that they do in regards to EMS care in the state, as well as trauma care in the state and caring for our pediatric population. Next, I will turn it over to Chief Garcia for a bureau report.
Well, thank you. I am going to be very brief this morning because we want to get to the important part of the meeting, and that is some recognition. But really quickly, we do have some slides that will be distributed as the update part of the packet for all of our EMS council members. Anybody that joined us for the State Trauma Advisory Board meeting, this is 100% a repeat. But we want to acknowledge that the governor has proclaimed again that this is National Trauma Awareness Month, and also next week, I believe, is EMS week. And so just acknowledging I think if you go 2 slides ahead, Shelley, just acknowledging that the theme for EMS week is honoring our past and forging our future. Today it is an honor and a privilege to be able to recognize some outstanding service from Arizona's EMS communities, and we look forward to recognizing and honoring our 4 EMCTs of the year. And next week as well, we also have, I think it is EMS for Children Day. We want to thank all of our clinicians and everybody for all the amazing work you do. We just can't say thank you enough. A few more updates. I want to focus on rulemaking for just a moment, and I will ask Dr. Bradley to chime in here. You all know that we have been very active at the department and, of course, engaging the stakeholders, with many of you having seats at the table during rulemakings over the last few years. Most recently, you can see some of the ground ambulance rulemaking updates went into effect in 2024. I just wanted to draw attention to some of our pending rulemakings that are ongoing. We do have EMR and critical care scope of practice that is ongoing. We have EMCT certification and training rules that are also open, as well as interfacility transport reporting requirements that are currently being discussed. The next slide has some links to some of the drafts that have been posted for public comment. And we are absolutely committed to making sure stakeholders are aware of when any upcoming meetings or opportunities for comment are this year on those drafts. Dr. Bradley, would you like to add anything about scope of practice?
Sure. Big thank you for Dr. Rice, who chaired the education committee. We had a special public session to really look at the education rules for both EMRs and critical care paramedics. So thank you for chairing that committee. I think that was well over 70+ people who participated and gave great feedback for that. So a big thank you to everyone who participated in that process. And then an even bigger thank you to our PMD and MBC members who gave us close to 4 hours of their time to go through scope of practice and kind of starting to work in the drug tables for EMRs and critical care paramedic endorsement. So that was on May 1st. We will have hopefully the draft scope of practice ready for public comment here, I'm hoping by the end of this week, fingers crossed. Once that is published, we will make sure that goes out via our Gov Delivery system. So a plug to sign up for our Gov Delivery email system. If you're not already signed up, that is how we disseminate information across the state. But we anticipate the scope of practice to hopefully get any public comment, get approval, and then that will go into effect January 1st with the updated rule package. But we wanted to make sure that agencies had enough time, if they wanted to do any training specific to the improved scope of practice, that was ready and available for you to use. So a big thank you to the committee members who participated in that process. Yes, are there any members that missed roll call that would like to identify? You can type your name in the chat or come off mute to identify your presence as well.
Just wrapping up here, I want the group to know that we are going to distribute this slide deck, so you have all the updates. I won't go over the rest of the slides today in the interest of time, but the packet will include updates on the SHARE program, updates on National Registry with some changes coming July 1. We want to make sure we continue to share that information with you all. The psychomotor exam is sunsetting per the National Registry on June 30th. But that requirement per state regulation does remain in effect in Arizona and most states across the nation, July 1, so no changes there. We'll keep distributing this information. We also, of course, have naloxone leave behind, our dashboard updates, and some trauma registry updates. So take a peek at those slides and please let us know if you have any questions there. But without further ado, I think I'll hand it to Dr. Bradley to go through any of the other items.
Thank you. And just one other item, just for everyone's awareness, the Strategic Planning Summit for those who participated. Again, another big ask of time for those who participated in that process. We will be bringing back to this committee in the September meeting a review of the updated strategic plan for review and hopeful approval for the next upcoming years. All right. And then the next is the EMS Data Quality Improvement Toolkits. These were approved by the Education Committee for chest pain, stroke, and TBI. And these have been posted to our website. Thank you, Dr. Gaither, for providing those. We just want to make sure that this committee was aware. If you're an agency that is looking for some toolkits specific to those entities for CQI processes, these are available on our website for dissemination and use. Pardon?
I clicked on one and the link was not working.
We will make sure that they are posted and functional and get you the links. Next, I will move to the presentation of EMCT of the Year Award. So I just want to say, number one, a big thank you to everyone that's here in person with us today. We want to welcome you to the Bureau of EMS at the Arizona Department of Health Services. This is our second year of doing these awards. Last year was the first time we did this awards program, and it was really a nice way. And I think both Chief Garcia and I felt really one of the more special meetings we've gone to as kind of the regulators. While we do a lot of public health work in the state, we often do a lot of more regulation. And so it's nice for us to take the time to really acknowledge and recognize all of your participation and hard work in the EMS community across the state of Arizona. Each of the regions were responsible for kind of disseminating the awards information out to their regions and then giving us who they decided to be their awardees. So the Bureau is not part of that process, but just wanted to say thank you. See lots of faces here in person, and I appreciate you coming. And with no further ado, we will hand it over to the Northern region first.
Wow.
Hello, everybody. My name is Doug Naminsky. I'm representing the Names Committee, and it's my great pleasure to introduce our awardee, Engineer Russ Smith. He happens to work for CAFMA, which is the agency that I work for as well. Russ, will you come on up? You've been nominated and given this award this year for EMTC of the Year for the region. Russ has been a paramedic for 7 years. Seems like just yesterday, I remember him going to medic school, causing all kinds of problems. It was a lot of fun. But Russ volunteers religiously for all the training events that we have. This winter, he was volunteering for Firefighter Angel, and he was a part of the group that was wrapping presents to give to kids. During the Christmas holiday, we do the Firefighter Angel stuff. So Russ was there helping to wrap presents, and it just so happened that one of our administrative staff coded right in front of Russ. Russ reacted quickly. He did everything a paramedic should do. He led the resuscitation, and she is here and alive today. She's not here with us right now. She's at work, but she is back to work, and it was an amazing thing that, you know, Russ got to do, and he did it in front of a lot of people. So a lot of people got to see EMS in action that don't normally get to see it. So with that, I'd love to present you with this plaque and say congratulations. Thank you, sir. Woo, 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 woo.
Thank you for more. Those of you online, so you can see the award. So thank you. Yes, so great. All right. So next for the Southeast region.
Be nice, sir. Yes.
Morning, everybody. My name's Tom Granuber. I'm the vice chair in the Sames region. It has nothing to do with the fact that I'm also the chief at Golden Ranch Fire District, and our award winner works for Golden Ranch Fire District. It was just a, but anyways, our winner is paramedic Dan Wallace. And there's so much I could say about Dan when he's been to Southern Arizona. He's worked for multiple agencies. He got his paramedic in 1994. And I think Vince might have a little more time than him, but not many other people. He's done so many things throughout his career. He's rewarded the Valor Medal for rescuing two small children in the Sahuarita Town Lake when a bouncing castle blew into the lake. He jumped in and rescued both those children. He's been a mentor and just a jack of all trades for everybody in our region. We were fortunate enough to get Dan out of retirement from Tucson Fire Department to come to Golden Ranch Fire District. And we were very fortunate to get him and all of his knowledge. The best thing I can say about Dan is his wife, Maureen, definitely married up, and she's been supporting him since they took paramedic class together. And he did just, share with me that he's never done a recertification. It's always been her. So Maureen, I appreciate everything that you've done for him and letting us have Dan. And Dan, I've always looked up to you and respected you, and you're just an all-around great paramedic and a great person. So I'd like to present this to you. Pack of lies, everybody.
All right, next for the Western region.
Try not to code while I'm up here.
You got it.
Yeah, go ahead. So, I think Jason and the chief and the man of the day gotta all come up here. You gotta be in the pictures too. Come on, guys. And I look at these guys and what they're doing, in their part of the Western region. And back a couple slides that said, great leaders create an environment where people do great stuff. That's these guys. Now, Forrest, I'm gonna turn it over to you.
Okay. All right. I have a little something to read real quick about Battalion Chief Maple right here. He's dedicated over 20 years of his life to ensuring the safety and well-being of the residents of Lake Havasu City. Throughout his tenure, he has consistently exhibited unparalleled leadership, compassion, and dedication to improving every aspect of the community of Lake Havasu City. One of Battalion Chief Maple's most notable achievements is his instrumental role in navigating Lake Havasu City through the ADHS CON process to implement a medical transport program that will significantly enhance the efficiency and effectiveness of the EMS service delivery for the community. Under his leadership, the response times to emergency calls have dramatically decreased, allowing residents in need to receive prompt medical assistance. Furthermore, he has implemented comprehensive training programs for the personnel of Lake Havasu City, ensuring that they have the latest knowledge and skills to handle even the most critical situations. Chief Maple's commitment to the community, outreach programs, and education have also made him a cherished figure among Lake Havasu City's residents. So I also personally know Tim Maple, and I've gotten to know him on a closer level over the past couple of years as he's been going through the CON process, and our department being able to help him with that as well. And there's not a better recipient of this award, so I couldn't be more proud to give Tim this award. So thank you so much.
And I would like to thank the Bureau for bringing this up. I think it was David had a big hand in it, but we had 7 folks nominated. All 7 deserve to be up here. So it's time. Thank you for what you do.
Region?
I'm good about.
I'm on behalf of the Central Region to honor Daniel Malinowski. A few things here to say about you. Daniel is a seasoned and dedicated emergency medical care technician with an impressive 19-year career in the field. For the past 18 years, he's been a vital member of the Buckeye Fire and Medical Rescue Department, showcasing his commitment to serving the community in times of crisis. Additionally, Dan has utilized his expertise as an EMCT educator at Glendale Community College for 14 years, imparting his knowledge and experience to the next generation of healthcare professionals. Dan's diverse background includes 6 years as a flight paramedic for AirVac and 3 years as an ED technician. He's earned 2 associate degrees in paramedicine and fire sciences, speaking to his strong drive to excel in his field and to continuously expand his knowledge and skills. Dan has been recognized for his exceptional dedication to EMS by receiving prestigious awards from Buckeye Fire Medical Rescue Department, including Paramedic of the Year in 2020, in 2022 and 2023. Wow. And the Chiefs Award in 2023. Pretty impressive. Dan is a dedicated community volunteer with a strong commitment to serving his community by involving in April Fool's Day, an event that raises awareness about drowning prevention and teaching CPR to the City of Buckeye lifeguards. You are a shining example of dedication and selflessness in the field of public safety, volunteering his time to help establish a cadet program for the Buckeye Fire Medical Rescue Department, and Dan's creation of The Nest, a supportive group for individuals interested in public safety careers, where he opens his home for skills practice, shows his genuine willingness to go above and beyond to support and mentor those who share his dedication to serving and protecting the community. Please accept this award and these wonderfully nice things that people have sent out. Okay. We're here.
Thank you.
Thank you.
If you can indulge us, we would like to have all the committee members, we're going to go in front of the table with all the awardees and take kind of a group picture. Megan's going to take that for us. And then also, if you would like to have some more formal pictures taken, downstairs on the first floor, there's a nice kind of Arizona flag that Megan will take pictures of you. So if you'd like some formal pictures taken down there, please feel free to go down there after that as well to take those pictures. So I have the committee members, we're gonna all kind of, don't trip on cords or chairs, please. But we've got good people around us when that happens.
It's nice to see everybody in person.
The 4 awardees with your plaques, please come up here as well. The awardees definitely. We'll have to get close here, but we'll make us all fit.
Just kidding. You're shorter than me. Yeah.
right. I might have to take this in two sections because it's a little bit too big. All right, ready? 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Great, thank you so much.
Thank you.
Is that your family?
Oh, yeah.
All here? Oh, I
I
love
want
it.
brother in.
Running around. Check if my head cut off. Fire shoe.
Yeah.
Interesting. I haven't seen you in forever. I know, right?
I can't believe it's you. Oh my goodness.
I saw you come in and
Holy
I said,
crap.
I know.
Come upstairs.
I will be after my wife's sitting on the committee, so.
Oh my God.
I know.
That's crazy.
Well done. Get off the cuff.
Yeah. Yeah, he's the mayor, you know. He is also the guy.
I'm gonna come back up and go to the picture.
You, yeah. Yeah. So,
Come down.
yeah. You too? Are you too? Okay, cool. Okay, cool. Yeah, I saw you leaving. I was like, oh, I just want to get you.
Yes.
That's really good to see you.
You're now real fast.
Yeah.
Why, but I.
Well, we will keep moving through the agenda as they go down to take their photos for recognition. So again, a big thank you to the 4 regions for helping to support this process. And really a gigantic thank you to Julia Benton and David Harden, who really are the spearheads of this recognition program and getting this together. I think last year they pulled it off in a very short time frame, and this year we at least had a little bit more time. But we appreciate the regions getting the message out and taking the time to evaluate the nominees. One of those things where hopefully we will continue to do this program, but really nice to be able to recognize people. And I believe one of the regions recognized all of their nominees as well. So I think it's really nice to hear that. Next, we will move along to our standing committee and regional council reports. First, Dr. Merrill with TEPI report.
Thank you. So as far as Tippy from March, I believe, minutes were approved. We displayed a slide for the share data for the elements for the PEAP status, which was approved as amended, and we'll go over today, it sounds like. Christina Kupinoff presented a slide to inform on wanting umbrella data for sharing agreement with all the trauma level hospitals for data for research. Had good discussion there and some interest. Dr. Bradley gave a background on wanting to capture fentanyl when possible for the AFDR. Krista Wilson shared it as an option in the pick list dropdown. Gail and Botzel shared the updated data for visualization pages for the off-road vehicle injuries and fall incidents. And then Ann Bosbrink shared the AZ Peers HB 2609 reporting requirement info, also posted the document response times for urbanicity report information and guidance in the AZ Peers website. So under the education and tutorials. Thank you.
Thank you. Next, Brian for Education Committee.
Right, at our March meeting, we approved our November 2023 minutes, our March 2024 special meeting minutes. We had a training presented for EMCTs for patient fall prevention, which we approved. That should be, I think, on the website now. The Alzheimer's Association presented info on their first responder product training. We did approve that to be posted to the website also. We had some updates to the naloxone leave behind training program that was approved. The Arizona Quality for Chest Pain, Stroke, and TBI QI was approved as amended and should be posted to share and time sensitive homepage. We approved some sepsis training. We we also had up for review continuous chest compression or chest compression only CPR. That was tabled to look at some data information that may be outdated. That will come up at our July meeting. Dr. Bradley recapped the March 14th special meeting. Dr. Johnson shared potential loophole for critical care recertification. We did not identify any more work groups that needed to be created at the time. Our next meeting will be July 18th at 10:30. PMD, we approved our November 2023 minutes. Dr. Bradley recapped the March 14th special meeting minutes regarding rules. A new iteration of the draft rules expected in the next week or two. Dr. Bradley prepped the group for the upcoming May 1 special meeting for EMCT scope of practice revisions on table 5.1. Dr. Davis presented info. Dr. Davis is one of our trauma surgeons at Flagstaff Medical Center, presented information to add finger thoracostomy to as an SDR to the paramedic scope of practice table. There was a point of order made as it was only up for discussion, and so that was not continued on at that point in time, and it will be back later on for critical care scope of practice that we approved at our May meeting. And so onto our May 1st meeting, we did approve adding the scope of practice, an EMR column and a column for paramedic critical care endorsement. A line was made for intranasal route unit dose pre-measured and removed an STR for paramedic on the thrombolytic line. We did make changes to table 1, the EMCT drug box list for EMR and paramedic with critical care endorsement. There was a new draft drug table 4 that was presented after much discussion on the drugs that were on there and how to have them listed and what to do with them. That was tabled. And then the table 3A and 3B, which is interfacility transport drug list and the hospital approved drug list, was tabled also until the July meeting for PMD. That's it.
For regional council reports, Central Region, Roy.
You're muted, Roy.
Well, you're on mute right now.
Let's try that again. First, I'd like to congratulate Daniel and all of the EMTCT awards. Strong work, one and all. In the interest of time, I will refer everyone to the Central Region report that was contained in the attachments, and with special attention to our upcoming EMS Odyssey Conference, which is going to be on June 13th, 2024. It is going to be by Zoom. Initially, we had attempted to do that by in-person meeting, but in order to accommodate many of our rural providers, we have decided to transition that to Zoom, and the last date to register is June 11th. We've been very busy, as you can see, through us with the OBLS training, rural outreach funding, etc. Please refer to the attachment. Thank you.
Next, Sarah for Sames report.
Hey, Gail, this is Dan Spate. I think Sarah had to step away for a call that she had to take. So I'll just report quickly. We had, since the last report, don't have a lots of report. We've had committee work going on, but not a regional council meeting. But the big announcement is the Southwest Regional Trauma Conference has changed its date to August 1st and 2nd. And that's it for Southeastern.
Thank you. All right, next, Northern Region, Vince.
I've submitted the names report if you'd like to read the details about our meetings and the great work we've been doing. We also would like to congratulate Russell Smith and Sean Bowker for their outstanding work that they do for Northern Arizona. Appreciate them.
Thank you. Even though Sean wore a U of A shirt.
She's proud of it.
Representing the representatives in the Northern Region had a U of A shirt. All right, and then next, Western Region, Rod.
So we earlier this month had our annual meeting, which is also our one of our general meetings during the year. At our annual meetings, we have elections and we re-elected Horace Taylor as president and Heather Miller as secretary. Um, if you find somebody who works that hard, why would you get rid of them? Let's see. We also awarded, as you talked about, the EMCT of the Year nominees at our meeting. We talked about the OBLS that we worked with the Central Region on, and we had some folks go to the Flagstaff classes and the Yuma classes, so that's great. And we updated our bylaws at that one. We included now as members any representative for Meade Centralized Medical Direction Communication Center. I had that there so I didn't mess that up. But anyway, so things continue to change. And our next executive board meeting is June 13th at 1 o'clock virtually. And the next general meeting is July 3rd in Pine Lake, person and virtually. That's it.
Thank you. Next, Dr. Woolrich for a PACES report.
Yes, thank you. Appreciate your time. We have our March 21st PACES meeting where we had approved our meeting minutes. We had two positions within the committee that was, those two positions were awarded to Chris Gilbert, who is our representative towards the Education Committee, and Jordana Carpenter, who was appointed to the vice chair role for the PACES Committee. You have an opportunity to run into either of those individuals, congratulate them and thank them for their extra commitment towards the efforts. During our meeting, we discussed our pre-hospital pediatric readiness assessment and our pediatric emergency care coordinator resource collaborative. Both of these are outlined as target elements in our EMSC state partnership grant that we work towards. And in addition, having additional resources with our EMSC Innovation Improvement Center, are making more CEs available in pediatric related content. In that, the Bureau does not issue CEs directly. We would be cooperating with our community partners towards that in the future to make that available to our EMS agencies across the state. We also discussed that of an issue of a pediatric recognition program. Again, this is an element. This is also an element within our EMSC state partnership grant and our partnership with the Innovation Center. The considerations on a recognition program was to consider a current model that we use in regards to premier recognition. Discussions were in regards to whether or not this would somehow integrate with current systems or be a standalone recognition for that pediatric premier recognition. This was only a discussion, but it seemed committee members preferred a standalone type of model. This will be on future agendas for discussion in PACES. Our next meeting will be July 18th, and I hope to see everybody there. Thank you.
Thank you very much. All right, next we will move to our discussion and action items. If I can get a motion to discuss, amend, and approve our meeting minutes from January 18th. Fine. Thank you. We've got a first and a second. I'll scroll through those. They're in your meeting packet as well. Are there any recommended amendments? Hearing none. Anyone opposed to the meeting minutes, please say nay. Any abstentions? All those in favor say aye.
Aye.
All right, and then next, we are going to just briefly discuss the EMS and trauma needs assessment and strategic plan. I think Julia is still downstairs with taking pictures, but Chief Garcia said she could handle this part. Bring the slides up quickly.
Oh, yeah, fair report slides. That's tech. Shelley. All
All right. Well, we just wanted to briefly cover the strategic plan and needs assessment update with EMS Council. We owe everybody a big thank you for those that participated in the surveys, the focus groups and listening sessions, and then the most recent April 10th Strategic Planning Summit. I think we've had 1,000 going on 2,000 participants in the process so far. And so quite a bit of feedback, especially from our diverse stakeholders that have participated. We talked to EMS Council about the process, I think, a year ago when we set out and started doing many of our surveys and focus groups. And we talked about listening, learning, planning, and prioritizing, and then doing by the time we get to 2025 with the development of a 5-year strategic plan. If you go to the next slide, Shelley, we wanted to give an updated timeline to everyone on the council. In January and February, we worked to finalize the needs assessment survey report and develop county and regional profiles, which were then shared at the Strategic Planning Summit in April. If the council is interested, we of course can redistribute those materials through the council so that everybody has access to the needs assessment report along with those county and regional profiles. We are now taking all the feedback that we received throughout this process, including the summit, and developing the strategic plan based on the feedback we've gotten on the draft priorities. We plan to bring that strategic plan along with the needs assessment back to the council in September to have the council review and approve that. In the interim, we of course will be working closely with the regions to get their feedback, and we look forward to making sure that we have a product that everybody can put their names and logos behind by the time we get to 2025. Again, with this being the goal of a 5-year strategic plan to help guide us as we approach, I can't believe it, 2025 to 2030. So those are some updates. I don't know if we have some of the draft priorities just to flash on the screen. We will definitely redistribute some of those materials from April. And if anybody that participated in those meetings has comments or questions about those needs assessment materials and data dashboards that were shared, we'd love to hear your feedback. I don't know if there's time today, but certainly, please reach out to us. Big kudos goes to Julia and the team for all their work on compiling the information. That's all I have for now.
And a big thank you, really, the amount of feedback that we got as part of the strategic planning process. And those of you that came and joined us for 4 hours, both in person and virtually, it was really nice to get such participation. I think with the initial survey, we had over 1,000 people that did the initial survey. We then had listening sessions with getting feedback from 4 regional councils, as well as multiple different stakeholder groups. And then between in-person and virtual had, I think, close to 150 participants in our summit. So we really feel that we've gotten some great feedback in this process. So again, thank you to those of you that participated in that. All right, next for discussion action items, if I can get a motion to discuss, amend, and approve shared data elements for Premier EMS Agency Program or PEEP status.
So moved.
All right. Okay. All right. So first and a second. So just a little bit of background about this. For those of you who have been on the council for a while, you may have remembered the term cactus. So we are not looking to recreate the cactus data dictionary. But what we do recognize is that we have had really AZ Peers data for quite some time. And as part of taking back over the data component for share from the University of Arizona into ADHS, we are really trying to find a way to really improve the data specific to cardiac arrest. When you look at share and what made Arizona a leader in cardiac arrest resuscitation, both at the national and international level, that was really because of all the work that was done by the EMS agencies. The development of the share program was really when most agencies were still often on paper records. I mean, that's how long share has been around. And so when we see how technology has improved, what can we do to actually improve that data? We know that some agencies do a really good job with the cardiac arrest elements, and others, I don't think they realize that how that data translates actually affects the data that we can use to produce the share report and look at our cardiac arrest data. So now that we have the data kind of internal to ADHS again, our data team is really looking to see what can we do to improve the data elements. Can we try to make that a little bit bigger? I don't know if we can. It is in your packet. if you have one of the packets as well. So on this table, what you will see is the NEMSIS data element, the AZ peer status and NEMSIS status, and then whether or not we would recommend this for PEEP agency criteria. So right now, to be a premier EMS agency, we state you have to have a certain validation score kind of for all data elements. What TEPI recommended and approved at their last meeting was to bring to EMS Council, really making for PEEP status that for cardiac arrest, we would add now specific kind of cardiac arrest data elements where you need to hit a certain validity score for that in order to maintain PEEP status. So that's kind of what we would like the group to consider. If you look at this, you can see that many of these, and we did quite a bit of discussion around A.R.S. 14. This is about date and time of cardiac arrest. This is the one that I think is often the hardest for EMS personnel in the field to figure out how to answer. And I think with some back and forth, and Dr. Gaither, interrupt me if I don't state this correctly, I think we came to a pretty good way to work around that with kind of input from the TEPI committee. So this would only be required if EMS witnessed the arrest. So kind of date and time is only required if EMS witnessed the arrest. So if the question above that is, did you witness it, as no. So EMS did not witness it, you would not get that data element. So that was kind of the workaround that we found, because what we've noted is that it's really tough otherwise to get someone in the field to say, well, I didn't witness this. How do I know what time this person arrested? So that was probably the one that we had the most conversation of. How can we actually use the validation rules to make people feel comfortable with answering that? The date and time of CPR, initial CPR, that is A.R.S. 19. That is marked as optional at the NEMSIS or level. We recommend this data element because we want to see when was CPR started, understanding that if you're the first one that arrives on the scene, you're the first ones doing CPR. If the patient gets dispatched and law enforcement gets there, you can maybe ask them, how long have you been doing CPR? So there is going to be a little bit of subjectiveness, but we do want to try to capture that data because really it is important to know from an outcome perspective, how long has CPR being performed? In the hospital setting, I think it's really important when I receive a patient with cardiac arrest to recognize how long has resuscitation been going on for this patient? How long have they been receiving CPR or not receiving CPR prior to EMS arriving on scene? Because that kind of does determine how long you continue to perform resuscitation on that patient. If you go down to the next section, you can see some completion rates. And with the completion rates, with these, you see many that have, if you can go a little bit bigger again, very high scores. We've got high 80s and 90s at a baseline for many of these. And there is an opportunity for some of these to really improve significantly from a data perspective. So you can see, you know, when you look at some of these date and time resuscitation discontinued, this is kind of important to know. What time do you, as the EMS provider, stop resuscitation? That's pretty low percentage right now. And then if you go down, who first applied this, the AED, if you're the EMS provider doing that, that's great. But if it's a layperson or law enforcement, we really want to capture that data because that is one of the things at the NASEMSO conference this week. One of the states presented on kind of, they got a huge grant to provide AEDs for all the law enforcement officers across the state. And what they found is that their cardiac arrest survival rates have gone up significantly. Right now, it's hard for us to capture that data when we only have 1% of AED use documented as to who actually applied that, whether it was EMS provider or law enforcement. So that's some of the things when you look for grant funding, it's much easier to get some funding to support programs if you have some data to go with that. The green highlighted at the bottom are the ones that we do not recommend obtaining those data elements. So that is the very long background, but I wanted to give a little bit of overview of kind of what we're looking for, the why, and then where we sit currently for the data. So I will open it up for questions, comments, and Dr. Gaither, feel free to pipe in if you'd like from a TEPI perspective. I see a head no. Thank you. Yes, Ryan.
So I have a question about date and time of ROSC, because that is an element when every time I submit a CEDAR report that goes in there, and the only way that I can do that, if it occurred before they got there because somebody used an AED, then it's probably not there. But if they get ROSC after EMS arrived, that is a required element. The only way I can get that is off the EMS report. So if it's not not in the data dictionary, then it's not required, or do we make that go away from Cedar?
Well, so right now, so the first step of this is to address the EMS data. So I think the first step is for us to look at the EMS data element because the Cedar data is still in the process with a share program of importing that in from the University of Arizona and figuring out how to potentially adjust that next set of the data element. So the Cedar data is going to be a little bit more complex to address. So the first goal of trying to improve the shared data is to really focus on the EMS data elements. With the next step of kind of looking at shared data, how do we look at the hospital data? So that will be kind of step 2, if that answers your question. I know, Anne, you are on there. I may call you to kind of answer some of the question about ROS. I know it's on here a couple different places. So we have A.R.S. 12 is any ROS or sustained ROS. And then I believe the reason for resuscitation being discontinued and the date and time resuscitation being discontinued, those data elements include ROSC. But Anne, I just want to confirm, I'm pretty sure that those two, that one, the reason you discontinue resuscitation is you get ROSC. So that is, and then that's date and timed as well. So it would be.
Yeah, I can confirm by looking it up, but I'm pretty sure one of the reasons to discontinue CPR that can be given is ROSC.
So it's kind of a duplicate question. So it's in there a few different places. So sometimes one of the things we want to do is to see, can we simplify this a little bit as opposed to asking the EMS provider to answer the same question a couple different ways. You're obviously going to stop compressions if you get ROSC. So it's captured there. Any other questions, comments? But yes, to Brian's point, which I think is a very important one, this is step 1 of us trying to kind of modernize, as I would say, the shared data, recognizing that when we first created this program in the state of Arizona, we were in a very different time technology-wise than we are now. And how can we make this easier for both the EMS agency, the hospitals, as well as the data team, kind of, and then improve our data as well. I will tell you that the CARES, which is kind of the national version of what we do as a share in Arizona, is having many of the same challenges. There are, I think, 30-something CARES states within the country right now, but they are having some of the same challenges of how do you potentially modernize the data from the EMS side of things, from the hospital side. One of the big changes with BEMSTS 3.5 is that those data elements were updated for what we've been kind of looking for. So there was a little bit of discrepancy in the past for the data elements under the previous BEMSTS data dictionary versus what's in the 3.5 version. And then the goal would be to have the completion rate be 90% or higher to maintain that deep status. So again, for those of you who remember, the initial cactus that was put forward for many years that we did sunset was, I think, a couple hundred data elements. This is really trying to parse it down to the thing that we know makes a difference in outcome, and I think will help our shared data and our cardiac arrest outcomes significantly. I know we have representatives from some facilities as well that input data and from agencies. Do you feel like from the agency perspective, this is something you can educate your providers on and kind of get buy-in on? Head nods. Head nods and some questions. I will say one of the things I find within agency perspective is sometimes the why are we doing this? We know cardiac arrest, we can help people survive, and we know the things that help them survive, right? CPR, early defibrillation, limiting time off the chest with high quality compressions. And so the way we can kind of gather that information is with data. But if we don't have great data, it's really hard to figure out where to put our education, where to put grant funding towards. So really, hopefully the message and the sales pitch to your personnel is kind of what we want to do and what they want to do in the field, which is to save lives. I see in the chat. Yep, and so, Anne, thank you for this is the reason the code's there as well. Dr. Godzenker, I see your hand up.
Hey, thank you. I just wanted to kind of express similar, like for people asking why, we're currently like at a conference right now and we're seeing data that's being brought forth by other locations and they're seeing like zero AED use, they're seeing zero out of hospital cardiac survival. And having the data collected, I really do feel will help shine a light where we need to continue quality improvement. So just echoing, if people have questions about why this is helpful, this really helps us target and know where we need to focus our efforts to continue to help our community. So thank you for putting this together.
Thank you. Dr. Gamer?
Yes, I think we're at a point where we just look at every data element and assign whether it's useful or not. And I don't see anything here that's not useful. I do want a little bit of clarity on who first applied the AED. Does that refer to a type of individual or a identified individual by name?
It would be a type of individual. So I believe the drop downs are like public or lay person, law enforcement, medical provider, or like the EMS provider.
Copy. Thank you for that clarification. Where are we in the process here? Do you have a motion to approve?
We do. I think, Anne, were you trying to say something?
No, I just wanted to confirm that it is correct. It is the type of person like bystander and something like that. It does not ask you to enter a name.
And, and one of the things I'm going to just kind of continue my sales pitch for a second here, just in case there's anyone who's second guessing this, but CARES has gotten a significant appropriations at a national level. This was based on what's called the CARE Act. And so they received $5 million, I think, a year to help support that to kind of expand that across the country, with really the focus now at a national level being on cardiac arrest outcomes and resuscitation. And so Arizona has kind of the SHARE program and CARES developed really at the same time. But this is our Arizona version of that. And so I really want to make sure that we are maintaining the high standard that we've always had as kind of leaders in resuscitation in the country for out of hospital cardiac arrest. But yes, Dr. Gamer, we do have a motion, so I will end my sales pitch. Any further discussion or questions or comments? All right. Anyone opposed to the addition of and I should clarify, we are going to make the recommendation that anything that has a yes, so column 4, the no's we would not include. So there are 5 no's. So therapeutic hypothermia was removed because that is no longer recommended in the pre-hospital setting. And then the other 4 were also removed to the bottom. So anyone opposed to the addition of the cardiac arrest data elements for PEEP status, please say nay. Any abstentions? All those in favor say aye.
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 Thank you very much, everyone. Next, any agenda items to be considered for the next meeting? We will have the strategic plan for review and approval for this council at the next meeting. But if you have any other agenda items, please forward them either to myself or Shelley. For call to the public, I first want to recognize Jim Hayden, who has let us know that he will not be renewing his time in the council under many, many years, serving as a member. So we appreciate your many years of service.
Oh, but just earlier when everybody got the awards, it made me more reminiscent of how long a lot of us have been in the industry. And so I wrote down some dates. My father-in-law started Phoenix Fire in 1963. And 38 years he served for Phoenix Fire. My dad worked for Glendale Fire from 1974, 27 years. I went to EMT school in 1986. And my youngest daughter, Emma, is a Scottsdale firefighter for 1 year. I was added together as 104 years in my little family with 3 generations. And now my daughter moving forward. So it's truly been an honor. It's been a thrill to be involved in what we do in this great state and having people so dedicated and involved. Many of you are dear, dear, longtime friends. Some of you in the room for more than 30 years, pushing 40, some of us. It's been a thrill. I'm pushing 60, so I'm choosing to go into the word semi-retirement. I announced the CEO of my company literally today. The email went out replacing me for my company, and focusing more on taking care of what we have left with this time. I'm still really involved in my nonprofit, thanks to Dr. Bimbro. Dr. Barbro had an idea, so he was involved in the study of the U of A for figuring out the life expectancy of paramedics, EMTs, and firefighters. And the study released, if you all may be aware or not, and you want to pull up the stopourstigma.org, Shelley. So this website, which is stopourstigma.org, you all can sign it. So paramedics, firefighters, and EMTs have a 39% higher rate of suicide than the general public. And it's a stigma issue because as firefighters, paramedics, and EMTs, people call 911 on the worst day of their life. And our job is to make it just a little bit better. But it gets hard, and it's okay for us to announce and say that we have concerns about how we manage that. But I think all of you have been to a funeral, and you stand around going, I wish I would have known. So we've embarked the 2023 and now 2024, our board. So if Jill, do you want to go to, so everybody, if you wouldn't mind, write it down, stopourstigma.org, and sign the pledge, and just get the pledge signed. And your pledge is very well articulated on what we do at the nonprofit. Pleased to announce today that stopourstigma.org and the entire campaign behind it has been 100% endowed. So all the expenses for the entire development of the program have been endowed, which, if you're familiar with nonprofit organizations, means that will live in perpetuity. The endowment is enough to be able to support that forever. By one person did that. So Shelley, if you hop over to emshelp.org and click on our board. So our board of directors, so emshelp.org actually is the nonprofit. And if you see the names here, Dr. Bradley, Dr. Bradley, Chief Brewster, Chief Dwiggins, and scroll on down through. And then announcing today that our newest board member is Chief Mark Gaylor, the fire chief up in Flagstaff, will be joining our board of directors at emshelp.org. So it's super exciting, the work that we're continuing to do. In the latest endeavor that we just finished now is actually pretty interesting. We developed a program and we just actually submitted a grant. We should hear back in the next couple of days of doing education statewide for family members and loved ones of us, to educate them on recognizing when you get home what's wrong and then do something about it. So the intent behind that is so we start thinking through, like, how do we educate all the time our own crews, and we have great talks and stations when we have calls. But at the end of the day, what do we do? And when we do get home and our loved ones notice that we've had a really bad day, and what do they do about it? How do they manage that? How do they mitigate when I come home and throw my boots or whatever I do, and whatever you do when you've had a rough day? Because again, I think a lot of us have been on calls. I've been in the funerals, and again, scratching your head wondering, I only wish I would have known. And how many times you've been to a funeral, they say it's an accident, and we know that it's not, because who knows better how to commit suicide than us? So with that, we're excited about this endeavor. Colonel Redzevic, who leads NIH, who's on our board, she just actually wrote the grant for us, and we should hear back pretty quickly. And we're really excited about that training module that's done. So all we need to do is get the funding. But if you get the opportunity to go and sign the pledge, I think all of us should keep in mind what it means for giving back to our community through both stopourstigma.org. And right now the campaign is directed toward firefighters. So if you go back to stopourstigma.org, Shelley, this first phase is dedicated to fire, and all the photos were all professionally taken, which is really hard because you don't see any cities, but we did our best to make sure that we delivered the message. It shouldn't be harsh. It shouldn't hurt to be a firefighter. And so we got, between now and the next 18 months, we have 4,000 impressions we're getting free from Clear Channel off the billboards. And so with Stop Our Stigma, So we've done really well about outreach. So you may see some of the billboards throughout Maricopa County as a PSA for announcing that as well. So thank you. It's been a thrill. And did it without getting choked up.
I have a question. Is the pledge on your site only for certified healthcare providers or for family members and public also?
The question was, is the pledge on your site only for certified healthcare professionals or is it family? If you read it, you can click anything you want on there. As a loved one, and there's a drop-down menu of who you are. It's a very robust website that goes into a very extensive CRM that we manage all the people that go through there, and you get a nice, great thank you for your pledge. So when you do click on the pledge, and after you go through it, you'll be able to see all the drop-down things of who you are in that process, because everybody either is one or typically knows one in healthcare.
Thank you very much.
You're welcome.
Anything else under call for the public? Upcoming events. There are a number of upcoming events on the agenda packet. As noted previously under the SAMES report, the Southwest Regional Trauma Conference date has been changed to, I believe, August. The next meeting will be September 19th at 10:30 a.m., both in person and virtual. And if I can get a motion to adjourn.
So moved.
Thank you very much, everyone.
Only for